So first, talking about low-level light therapy, and it's called LLLT for low-level light, also LLLT for low-level laser. So those terms seem to be used interchangeably, and both seem to be relevant. It's also been called cold laser, soft laser, low-level laser, but it will commonly be called just laser within the clinic. It seems to be getting more popular within the clinics due to approval by the FDA in 2002. There's a lot of research on it, more and more is mounting. However, because of the reimbursement issue, it still seems to be limited. It's reimbursed at the 97039 unlisted procedural code, much like oftentimes dry needling is also utilized in that code. Some clinics have a hard time getting reimbursements at this using this code as opposed to a manual therapy or therapeutic exercise code. So a lot of times clinicians won't even use laser because they have trouble getting reimbursed for it. So one of the biggest barriers to laser and why it's very uncommon is because of the difficulty with reimbursement, although research may show otherwise. So when we talk about phototherapy, we're just talking about light therapy. I'll start with a little clip here. First of many clips. I hope it worked. Let's see.
You know, I have one simple request, and that is to have sharks with frickin' laser beams attached to their heads. Now, evidently, my cycloptic colleague informs me that that can't be done. Can you remind me what I pay you people for? Honestly, throw me a bone here. What do we have?
Okay, so there you go. So I'm going to throw you a bone here. So we're talking about light therapy. There's really regular light, incoherent, and then laser. And laser really is ultimately just more focused light. And the key thing from this slide, and one of the most important things about this lecture, is the depth of penetration. We're looking at 4 centimeters or approximately 40 millimeters. Just to give a reference, that would be approximately 2 pennies side by side, the width of those 2 pennies, or diameter of those 2 pennies. So thinking about structures that you may be able to target with that, and structures that would be too deep, such as the piriformis muscle, would borderline in some individuals as being too deep for that. Obviously lumbar discs and other structures, depending on the frame of the person, may be too deep for that. So let's talk about this a little bit more. Obviously you have ordinary and laser light. We're going to show you different types of SLD, LED, and laser diodes. So laser diodes are going to be the deepest here. So to show you representation of that, it depends on wavelengths. So what we're looking at is on this end of the spectrum, you have ELF waves, are extremely low frequency, and then you have gamma rays on the other end of the spectrum here. So these are very intense rays, and this gamma ray or gamma radiation will be associated with the cancer procedures, cancer surgeries. So that's called the gamma knife. Also, for the comic book fans, Bruce Banner working in the lab one day, exposed to the gamma radiation, and then he became the Hulk. So gamma rays are good for removing cancer or turning you into a big green monster / superhero. So you have that, but we're going to focus on the visible light range within here. Let's play some Austin Powers.
Why make trillions when we could make billions?
So that's what we're talking about. So going back to the beginning of the unit, we talked about the different units in the metric system. So you have hertz, then you have kilohertz, which would be 1,000 hertz, or in this case 3 kilohertz would be 3,000 hertz. And then M for mega, meaning 1 million. So you have 3 million hertz at this frequency here. And moving along here, you can see gigahertz and some very, very big numbers here because the wavelengths are so narrow. So when we're talking about the wavelengths here are very large here, and so starting at a distance everyone is familiar with, 1 meter, approximately 3 feet, is within this wavelength, and then you have 100 millimeters. So milli meaning 1,000th of a meter. And then you have much smaller here, micro for 1 millionth. So 1 micrometer would be here. And then over here, you would have 1 nanometer. So nano being the metric for 1 billionth of a meter. So within visible light, we're talking roughly between 400 and 800 nanometers. And that's the range that we're at. Our applicator at RU has an applicator of 820 nanometers for the wavelength there. And that will correspond with a certain depth of penetration, which we're going to talk about next. Okay, so talking about phototherapy, there are three main types in the use of laser. Let me see if I could use my pen here just to kind of start to use this. Okay, so you have laser, which is going to go the deepest. Then you have LED. It's going to be through multiple diodes, and that's what's pictured here, these multiple diodes. Then you also have SLD, and it's more focused. And oftentimes what you have is a combination applicator in this form called the cluster probe. So that's what. Going on. So this will be an important slide here. This is a good slide to know to understand the different depths of penetration. There's LED, SLD, and laser. And once again, that laser is the form that we have within lab. So these are all forms of essentially visible light within the spectrum of light there. Penetrates 2 to 4 centimeters or 20 to 40 millimeters, either way. But keep in mind the LED is very superficial, much like the light for an LED television or monitor or anything like that, very superficial. I believe we have a sound clip here.
You're quasi-evil. You're semi-evil. You're the margarine of evil. You're the Diet Coke of evil. Just 1 calorie, not evil enough.
Right, so that's what the LED and the SLD, they're like laser. They are forms technically of laser, but they're not as deep as the true form of laser that we're dealing with. So for use with patients, we want to use this form of laser. Now, what are some of the biological effects of laser? Well, just like many other modalities, it actually expedites the healing process. One of the areas it does that with is with ATP production, which is obviously very important for cell energy. Within the mitochondria of the cells, the ATP produces a large amount of energy, obviously. So if we increase the energy available, the healing process will speed up. You obviously have fibroblasts for collagen production, and we do know that collagen production is biggest within the proliferative phase. And initially, remember, we have type 3 collagen, and it progresses over to type 1, the stronger form of collagen. Initially, the collagen is laid out in almost like the haystack, and then as it becomes stronger and as it's exposed to stresses, it hopefully and ideally will arrange itself in a more perpendicular pattern, like a mesh screen, to become stronger. So that's what you would ideally like to see there. Increased blood flow through nitric oxide is important. To a lesser extent, there are some other benefits of bacterial growth and nerve regeneration. However, I would focus more on these aspects of laser at the cellular level. Laser therapy, getting back to the wavelengths within 500 to 1100 nanometers, we would deal here. Now, how is it measured? Well, it's measured in milliwatts, which would be 1/1,000,000th of a watt per square centimeter. That's what we're dealing with here. Within the range of 5 to 500 milliwatts. So once again, this is a very important number to know because this will be the therapeutic range. Laser pointers and things like that will display via a small sticker. If you look at a laser pointer sticker, how much milliwattage is there. But by law, it has to be less than 5 milliwatts to prevent damage. But even at that level, there still is the likelihood of eye damage if exposed. So for that reason, we are always wearing sunglasses, protective eyewear, especially because we're in this range as opposed to laser pointers within this range. And at the other end of the spectrum, we're looking at the other lasers surgically to kill tissue, especially cancer, but also the good tissue, unfortunately, that goes with it. We're dealing with approximately 300 watts. So this is a very weak laser that we're using compared to the surgical lasers. And obviously with hair growth, there are some devices commercially sold for women and men that are looking to kill the hair follicles, and some of those devices are in the 40 watt range. But that is just FYI. That is not obviously important. Schulz Law, which is important. This comes up with laser, but also with ultrasound and many other concepts. Besides this, this especially applies to exercise and other principles. It's very similar to the bone healing law, Wolff's Law. But the basic idea is Goldilocks and the Three Bears. So if you have the stimulus which is too strong, it can kill tissue, such as the gamma knife, which may be your desired effect. If you have a dosage which is too low, such as just a laser pointer, it's not going to cause enough. But if you have just the right therapeutic dosage, 5 to 500 milliwatts, ideally you may get the appropriate physiological effects. I don't know what this is. I forget. Let's see.
Throw me a frickin' bone here. I'm the boss. Need the info.
So there you go. Another way to put it. But you got to be within that sweet spot. And that's what the Schulz Law is dealing with. Now, talking with frequency and wavelength. Remember, this is programmed into the applicator, so it's not something we necessarily change with laser. However, this will come up again with therapeutic ultrasound. We do have the ability to change this on the machine itself. It's not something that needs to be changed through the applicator. However, through laser, it is different than ultrasound. This is a pre-programmed wavelength within there, and that's what we're dealing with. So ideally, without getting into numbers, the general concept that's very important to realize here is the bigger the wavelength, the smaller the frequency. The smaller the wavelength, the higher the frequency. So you have larger waves, lower frequency, smaller waves, higher frequency. So that would be obviously what kind of relationship? Well, we're dealing with an opposite or an inverse relationship. So it's not it would not be a linear relationship, whereas it's an inverse relationship where the wavelength increases, so the frequency decreases, and so on. So that would be what we're dealing with here. This is important because of tissue depth. The lower the frequency, the more superficial. The greater the wavelength will be a lower frequency, and that would be deeper. So these types of waves would be more superficial. These types of waves are more deep. And that'll be a concept that also reappears in the ultrasound unit.
Before beginning low-level laser therapy, make sure that both you and your patient are wearing the protective eyewear, and that you look good while doing it. Once you've positioned the patient in a comfortable position, explain to them the treatment and hand them the emergency stop button. This particular patient has come to us with acute arthritis in his MCP joint, so we'll use a protocol of 2 to 4 joules per centimeter squared. So now that the machine's on, you can set up your treatment time, and you're going to do this by selecting the amount of power you want to deliver your energy at through the laser. Duration is going to be based on dose, so the machine will calibrate this for you. And you also want to make sure that you change your units to joules per centimeter squared. So now that you've set your parameters, you can go ahead and start treatment by pressing the start button. When you're applying the laser, you want to do it directly over the skin with firm pressure perpendicular to the surface. And once you've gotten your position, you can go ahead and press the button on top, and the laser is now working. If it's over a painful joint or wound, keep it just above the skin surface. And if it's over a large area, you can apply it to the adjacent area about 1 inch away from the prior treatment region. And you can do this pulsed or continuous.
Oh!